Hi, welcome to our video. We are from Group 7B. We'll be presenting for you about our case on home medication review. I will start with patient data and relevant history. Patient name is Mr. ABB, 62 years old, Malay with weight of 74 kg and height of 155 cm. The BMI of the patient is 30.8 kg per m squared. He is diagnosed with hypertension, dyslipidemia, and diabetes. About his social status, he is married and the highest educational level is primary school and he is just a pensioner. Continue to current medication. There are 7 medications prescribed by the doctor. Perindopril, hydrochlorothiazide, amlodipine, and metoprolol was indicated for hypertension. Simvastatin 10 mg was indicated for his dyslipidemia. For diabetes, metformin 500 mg was prescribed. Lastly, for potassium chloride prescribed as prevention of hypokalemia. Moving on to drug-related problem and pharmaceutical care issue. The first issue for this patient is poor understanding on medication. Based on previous visit, patient unable to explain the name and the dosage of the drug regimen. Patient confused with medication taking due to many medicine taking at the same time. And also, patient taking wrong dose of medicine. Second issue is BMI of the patient categorized under obese stage 1 which associate with high risk of comorbidity. The third issue is drug-disease interaction. Beta blocker may mask sign of hypoglycemia, prolonged hypoglycemia recovery, and could cause dyslipidemia. And also, statin therapy may increase the level of HbA1c and FBS. Next issue is uncontrolled blood pressure. The blood pressure reading is more than 130/80 based on first and second visit. The targeted systolic blood pressure for elderly patient is below than 140. It is much preferable to target below than 130/80 for patients with hypertension, comorbid diabetic with, and high risk of cardiovascular disease. The possible reason of uncontrolled blood pressure is due to low adherence to medication. Patient try to stop hypertensive drug due to side effect of medication, and the potential ineffective therapeutic outcome. According to CPG management of hypertension, if BP is still not controlled within sufficient period of time, the dose of initial drug should be increased. The maximum dosage of perindopril is 8 mg per day and metoprolol dosage is 450 mg per day. However, this patient received the lowest dosage of perindopril and metoprolol. Lastly, there is some issue of inconvenient medical follow-up. This is because the distance between patient living area and clinic for medical follow-up was far. There are some interventions that can be done to optimize the efficacy of medication. We would like to introduce medication assistance tools such as medication chart, pill box, and pill cutter to improve patient knowledge and adherence to his medication. Medication chart can help to increase patient compliance, and the chart content included with name, dose, and the time to take the medication. We will request patient to put it where he could easily notice. Pill box can help to prevent confusion on drug administration and promote proper management of medicine, while pill cutter can add split pill into half evenly. Next, we would like to educate patients on possible side effects may face and the importance of medication compliance and the complication of medication non-adherence. Next, we will suggest patients to have lifestyle modification such as regular exercise and take proper diet to enhance patient knowledge and awareness about healthy lifestyle. Referral letter to his physician is good idea as the patient had uncontrolled blood pressure due to adherent issue and ineffective therapeutic dosage. Patient might not able to tolerate with current hypertensive drug or experience inadequate hypotensive effect from medicine, and the dose of antihypertensive medication should be revised. We also need to advise patient to inform physician if still having dizziness after taking antihypertensive drug. Lastly, we need to ask patient to discuss with his physician for more convenient approach for follow-up by searching nearby clinic for next appointment. If possible, use post service to send the patient medicine. After discuss with teammate, we choose medication chart as our main intervention. This educational material is aimed to assist patient and his caregiver in daily medication handling. Interestingly, there are some special features in this chart. The chart is added with picture of medicine to help patient recognize the medication more effective. Also, the chart included with name, dosage, and indication to help patient learn more about his medication. We also provide with local language, Bahasa Melayu, and layman term to help patient understanding. It is easy to read as the word size is big enough. We hope this intervention can help to increase adherence to medication. These are products were made. Please take a look at it. For monitoring plant efficacy, we need to monitor blood pressure and blood glucose level. We need to encourage self-monitoring by the patient. It is suggested to monitor blood pressure at least once a week and blood glucose every 3 months. A1C and lipid level can be checked during follow-up. If LDL-C target achieved, lipid profile can be repeated at 6 to 12 month interval. If not, more frequent monitoring needed. Also, monitor weight of the patient as weight loss of 5 to 10% will improve glycemic control, blood pressure, lipid profile, and quality of life. Continue to monitoring plant safety. Monitor blood glucose level as metoprolol can mask hypoglycemic symptoms. Monitor weight and blood pressure as it is affected by hydrochlorothiazide. For amlodipine, monitor heart rate abnormalities. Also, monitor serum potassium, chloride, and magnesium level as it is affected by potassium chloride. For perindopril, we need to reassess renal function and serum potassium periodically. Monitor sign of hypotension, hyperkalemia, or sign of renal function deterioration. For simvastatin, monitor the baseline hepatic transaminase level and measure hepatic function if it have toxicity symptom. For metformin, it suggests to do a urine test for glucose and ketone test. Also, we need to monitor hematologic parameter, renal function, and vitamin B12 serum concentration for prolonged therapy. These are some references used for this presentation. Thank you.